looking for food, starvation, the recipe, people subdued. When the people you trust got it in for you. Deceit is the word of the day in every crew. Don't let it go, it's from the days of old. Time is up, but some still do not know. Can I make up my mind? Is it worth the dime? Do I have to take a minute just to make it mine? Life's never fair, but don't listen to the TV. Go out and take a listen to the streets with the people in the slums and the homeless bums with degrees and degrees sitting under a tree. It's not easy in the world for the poor man, the one that brought you to reality. See, they don't want you to know about the black sheep. Even 7 rows to the 12 families all around the globe with an ancient code. Is it really asking a lot to say a that's old? Cause we sitting on the earth looking back at extinct, and I'm standing on some ground that's about to sink. I ain't scared for a minute, I ain't about to blink, but I documented for the world what I see and think. Feel we on the call and I feel we on the break. All Congress gonna do is waste paper and ink. Vote or die, you voted and you'll die. You can have it both ways, can't say it's a lie. You can march all you want, but they playing you wrong. They only understand war, it's the same old song. They want war, all they really want is a war. Diversionary tactic to make the pigs fall. The diamonds in the morning, you know they want more, but they wanna keep it low, so they manifest the war. All they really want is a war. Diversionary tactic to make the pigs fall. The diamonds in the morning.
Check 1 2 1 2 1 2. All right, so here we go. Now back at it again, and it is February 27th, 2012 Central European Time. That would make it 2 p.m. Eastern Standard Time, America. And that would make it, what is that? That would make it 11 a.m. Pacific Time, roughly around there. What's up, everybody? Now, there is a special story. And, I missed the first time that this happened. But this story, this next little ditty we're going to do here, and I hate Diddy gives that a bad name, but he didn't invent it. So, but the next story I want to cover here is the Henrietta Lacks story. And for those of you that don't know who Henrietta Lacks is, I mean, it's an amazing story. It's an amazing story. Let me go through a little bit of it. She was an African American. She was an African American. I mean, she passed away some time ago, but she's an African American woman who unintentionally contributed to the science that changed the world, though she never knew it during her time. Right? She's the woman behind the HeLa cells. Right? For those of you that don't know. Okay. So Henrietta Lacks was born in 1920 in Virginia. Henrietta Lacks was a mother of 5 living in Baltimore, Maryland. Right. So this is in 1920. She was born 20 years before my pops. Right. Before my parents. Right. In 1951, she went to Johns Hopkins Hospital. Right. One of the few hospitals that treated black patients at that time, complaining about a knot in her wound. Right. She was diagnosed with a particularly aggressive form of cervical cancer. Right. Now, the HeLa cells. During her treatment, a doctor took a small sample of her tumor without her knowledge or consent. Right. At that time, scientists had been trying for decades to grow human cells in a lab. Right. But they always die quickly. So when they tried this experiment every other time, it just wasn't possible. It didn't work. The cells died prematurely. Sorry about that. But Henrietta Lacks cells were different. They never died. They doubled every 24 hours. A breakthrough, right? These became the first immortal human cell line, known as the HeLa, derived from the first 2 letters in her first and last name, right? Henrietta Lacks. So H-E for Henrietta, L-A for Lacks, her last name. Now, her global impact. I mean, this is interesting because this is a global impact. Now, while Henrietta passed away from her cancer in 1951 at the age of 31, her cells lived on, right? Her cells lived on. They have been used in nearly every major medical breakthrough of the last century. This is not a joke. Of the last century. Polio vaccine, HeLa cells were used to test Jonas Salk's vaccine, right? Cancer research, studying how cells became malignant and testing chemotherapy. Yes, so if you ever had to go through chemotherapy, you have intersected with Henrietta Lacks. I'm going to bring up a picture in a second. COVID-19 vaccinations. Yeah, if you ever had a COVID-19 vaccination, you have intersected with this black woman by the name of Henrietta Lacks, right? Gene mapping. Her actual the cells that they took from her tumor, they help scientists understand the human genome. Yes. The ethical controversy, however. For decades, Henrietta's family had no idea her cells were being bought, sold, and used in labs across the globe. They only found out in the 1970s when scientists contacted them for blood samples to study Henrietta's genetics. They wanted more blood from her family, right? Offspring, right? And her body, her actual body, somehow, I guess, they could derive it from DNA or something, right? Now, right. Well, they wanted to contact the family because they're her bloodline. Now, the story became a symbol of medical exploitation of Black Americans, sparking a massive conversation about informed consent and who owns your body once a sample is taken. Now, some guy. This just reminds me. I know already someone is going to come up and say just because the word Black American was used, somebody's going to see this whole thing as racist. No, this is frontline news as of the last 24 hours, like straight up 48 hours, and I'm going to show you. Okay, so let's pull up some of the data here, so people can see. Let me see here. Articles. Boom. Let's pull them up. Stanford University. All right. So Trump's probably going to want to have this taken down possibly as soon as possible. But this is Henrietta Lacks. So if you had the COVID vaccine, if you had other, let me see, there were other, what did they say? It was used, her blood, her genes. Right. Here it is. Her bloods, her cells, her HeLa cells were used for testing Jonas Salk's vaccine. Cancer research studying how cells become malignant and testing chemotherapy, right? So chemotherapy testing, right? COVID-19 vaccines, right? So, and gene mapping. So if you had anything that had something to do with that, you have intersected with this woman, Henrietta Lacks. Okay. The complicated history of the HeLa cells, Henrietta Lacks' legacy, and biomedical research. Now, let me pull up a couple of other articles here. Well, here's the thing. As of today, what happened again? Her family won another medical case. They won a lawsuit. And this is just as of today. They won one other, but this has been ongoing for some time. Okay, so here we go. The legal battle for Henrietta Lacks' estate has moved from the pages of historic books into active federal courtrooms. Her descendants, led by her grandson, let me turn this over. Her descendants, led by her grandson. Let me see. Can I get this? Can I get this out while I'm doing this? Let's see here. Where's the camera? Right. Yeah. Her descendants, led by her grandsons, right, Ron Lacks, have shifted their strategy towards targeting multi-billion-dollar biotechnology and pharmaceutical companies that continue to profit from the HeLa cell line. That's her actual bloodline, the cells that they took from her. Had they not taken it from her, they wouldn't have them. Seriously, this is reality here that we're living in. I don't know. It's just some people ain't going to get it. But here's the current state of the civil litigation. As of early 2026, significant settlements. The family has successfully reached a confidential settlement with two major industry giants. While the financial terms are never disclosed, these settlements are seen as a major victory in the family's genetic justice campaign. Right. So let's pull up this article here. This is an EU article, by the way. That's interesting. So this is coming out of the EU. Can I get this up or what? Okay, and there's one from California. Okay, so can I pull this up? Or I have to go to the bottom? Here, well, I'll pull it up in a second. Let me see here. Where is it at? Is it here? Where are we at? Or is it down here? Sources. Okay, let's do the sources. Is it only John Hopkins? For some reason, those other ones didn't come up. I don't know why that is. But in any case, I will pull these up. Can I get them from here? Okay, lawsuit just here. Okay, well, we'll get into that in a second. So here we go. Significant settlements. Thermo Fisher Scientific settled August 2023. So this is the first company that settled with her. This was the first major lawsuit. The family argued that the company was unjustly enriched by mass producing and selling HeLa cells, despite knowing they were taken without consent in 1951. Okay, the settlement was announced on what would have been Henrietta's 103rd birthday. Okay, yeah. So now this is the new one. Novartis settled in February 2026. This just happened. In a very recent development, the Swiss pharmaceutical giants settled a lawsuit filed in 2024. Kudos to them for settling the lawsuit, man. That's great. That's a great. I think it's a good thing to do. You know what I'm saying? When a wrong has been committed, there's nothing wrong with trying to correct it, to do what you can to correct it. You know, the estate claimed Novartis held hundreds of patents derived from the HeLa cells and used them to develop drug like Famvir, herpes, and Zolgensma gene therapy. That's interesting. Okay. Now there's two other cases. There's other cases now also outside of that. These have been settled. Now there's more active and pending litigation. The family's legal team, including prominent civil rights attorney Ben Crump, have indicated they intended to pursue more companies. Ultragenyx Pharmaceutical. This case is currently the most active frontline. Ultragenyx, rare disease drug developer, attempted to have a case dismissed, arguing the statute of limitations had long since expired. However, a federal judge recently denied their motion, allowing the case to proceed. The court ruled that if the company is profiting now, the unjust enrichment claim may still be valid. Right. Viatris sued along. Okay, this is another company. Viatris sued alongside Novartis in 2024, formed by the merger of the Mylan and Pfizer. Okay. Damn. Pfizer Upjohn remains a defendant. The estate alleges that the company uses HeLa cells for testing various pharmaceutical compounds without compensation. Okay, damn, that's also another big one. Okay, how many articles are written about this? Okay, there's two. Okay, so now then there's the core legal argument, unjust enrichment. The family strategy avoids suing over the original 1951 theft, which would be barred by the statute of limitation. Instead, they use the theory called unjust enrichment. Okay, the logic. Even if a company didn't steal the cells themselves, they are currently holding a benefit, profits from HeLa cells that is inequitable for them to keep without paying the rightful estate. Right. The defense. Companies generally argue that they didn't do anything illegal at the time, that the cells were discarded waste, and that the family waited too long to sue. Well, that's kind of cold. You know, but you know, nonetheless, it didn't work. Now let's see here. This is Henrietta Lacks, everybody. This is her. And let's go over to this article again so people can get a better picture of her. This is her, right? And people have known about her for some time. Maybe a lot of people didn't know because there was no court cases won. So a lot of times people are interested when money gets involved, right? They're not interested in what actually is going on medically, you know, in the medical world. But let me see something. Now, let me just go back to this, and I want to dig up a few things. Now, what medicines or treatments were her cells used in? Yeah, let's see. I'm just curious. I want to get a straight fact list of this real quick and see. Okay. Damn. Because Henrietta Lacks cells HeLa were the first to grow indefinitely in a lab, they became the gold standard, right? For testing almost every major medical advancement of the last 75 years. If you have ever had a vaccine, a treatment for a blood disorder, or a standard cancer screening, you have likely benefited from the testing with her cells. All right. Vaccines. HeLa cells were the essential proving ground for vaccines because they allowed scientists to see how a virus infects human cells without testing them on a person. So without her cells, they would be testing people before they could provide help. So you would be the guinea pig, in other words, or an animal would be. You decide. Do you want a person's cells or do you want an animal, or you want to be the test yourself? You decide though. Polio. 1952, Jonas Salk used HeLa cells to test his vaccine. This led to the first mass production facility for human cells in history. HPV, cervical cancer. Okay, we went through that. Yeah. Okay, COVID-19, right? And others. They were used in developing or testing of vaccines for mumps, measles, and Ebola also, right? Cancer treatment, chemo, drugs, right. Camptothecin, used for ovarian and lung cancer. Vincristine were refined using HeLa cells, right? HeLa cells. Hydroxyura. This drug was tested on HeLa cells and is now a standard treatment for sickle cell anemia. Okay, radiation therapy. HeLa cells were the first used to study how X-rays and radiation damage human DNA, helping doctors set safe dosages for cancer patients. Infectious disease treatments. So they could grow her cells in a lab, so that means they had plenty of them. They could successfully grow her cells. It wasn't possible until her cells were introduced into the picture. So they call her cells like the gold standard. You see what I mean? So because you could reproduce them, you could use them for a lot of testing. You see? Trial and error. Infectious disease treatments. HIV/AIDS in the 1980s. HeLa cells were used to discover how the HIV virus infects cells. This paved the way for antiretroviral drugs that make the disease manageable today. It's interesting because look, they didn't tell her. They took her cells without telling her, and it kind of harkens back to this idea of whose body is it? Do you have the right to your own body? Do you own your own body, or does someone else own your own body? And this argument takes place across a lot of different realms. The thing about who owns your body, right? Does somebody else own your body? Can someone else tell you what to do with your body? All of that, you see what I mean, harkens back to a similar time period, So this was she was born in the 1920s. That happened in the 1950s. That's during Jim Crow. Just straight up. That's the time period. So everything that was happening within the scope of that time period, So let's see. Tuberculosis, salmonella, advanced medical procedures, in vitro fertilization. Yeah, Trump knows about that, right? Maybe. Yay. Gene therapy. Okay, key discoveries at a glance. Okay, treatment field. Let's see here. Let me blow this one up a little bit and see if we can get it in here. All right, let's see here. Boom. Can I make that smaller? Yeah. Let's see here. Boom. All right. So we got the treatment field, role of the HeLa cells, right? Am I seeing everything? Yeah. Okay. Polio vaccine, right? The large scale test host for virus, HPV vaccine, proved the link between the virus and cancer. Blood disorders, tested the efficiency of hydroxyura or urea. I'm sorry. Okay. Gene mapping used to create the first human animal hybrids for mapping. Okay. Damn. Parkinson's disease. Trump, pay attention, Trump. Used to study the effects of dopamine of the human brain cells. Okay. Damn. Would you like me to find more details on how our cells were used specifically in the development of COVID-19 vaccines? Yeah. Yeah, let's see that. Damn, and that reached all the way over here. And I think I got the Pfizer vaccine, to be honest myself. But let's see here. Let's go back to this now. Maybe I can make this larger again and pull it back up. Yeah. So let's do that. Now let's see here. Okay. HeLa cells played a crucial behind-the-scenes role in the development of the COVID-19 vaccine. While most public conversations focused on the use of fetal cell lines like HEC-293, HeLa cells were used by researchers globally to solve the fundamental mystery of the virus itself. So, yeah, damn. Here's exactly how Henrietta Lacks cells contributed, modeling the entry point. To make a vaccine, scientists first had to understand exactly how the SARS-CoV virus breaks into the human cell, right? Yeah, so ACE2 receptor. Scientists use HeLa cells to study the H2 receptor, the lock on the surface of the human cell that the virus spike protein uses as a key. Infection testing. Because HeLa cells are so hardly research engineered them to express high levels are so hardly researchers because HeLa cells are so hardy, I get it, like hardy, in that way. Researchers engineered them to express high levels of these receptors. This allowed them to watch the virus infect the cell in real time, helping them identify the spike protein as the best target for the vaccine. Testing vaccine proof of concept. Before the Pfizer and Moderna vaccines could be tested in humans, scientists had to prove that the mRNA instructions actually worked inside the human cell. HeLa cells were used in the vitro test tube petri dish. Experiments to confirm that when the vaccine enters the cells successfully produce the harmless spike protein needed to train the immune system. A recent 2024 study used HeLa cells to observe how cells produce the mRNA from the BioNTech, Pfizer, and the Moderna vaccines, specifically looking at how the cells handle the protein's production internally. Antiviral and treatment screening. Beyond the vaccine, HeLa cells were used to test existing drugs to see if they could stop the virus. Drug repurposing. I'm sorry, damn, my English is getting terrible. Repurposing. Drug repurposing. Scientists screened thousands of existing medicines against affected HeLa cells to see which ones could block the virus from replicating. Protease studies. Researchers use HeLa cells to study how specific enzymes like cathepsin L help the virus fuse with our cell membranes, which has led to research in new antiviral pills. Cathepsin L. Damn. All right, let's see here. I'm going to check that out. I want to see what that's, because I don't even know what I'm not into cells like this, but I thought it was an interesting story about Henrietta Lacks. It's amazing. This story still lives on. I think this is one of the most underrated stories in science, in medicine, particularly in medicine. It is. And if you never heard of Henrietta Lacks, you should definitely bother to look her up, because this is just an amazing individual. The cells. Just to think that just one person, that one bloodline out of 100 or 1,000 people, because they tested many. They tested many people's cells. I don't even know how many in a million. Let me see here, but I'm going to get to that. Understanding mutations. As variants like Delta and Omicron emerged, HeLa cells were once again the standardized lab bench. Researchers used them to compare how much more or less effectively these new mutations could bind. Let me see here. Could bind to human cells compared to the original. 1 second. compared to the original strain from 2020. Summary table, cell lines in COVID-19 vaccines. Okay, so listen, people get, damn, is this many? Okay, HeLa cells, Henrietta locks. Okay, Henrietta locks, 1951. Basic research modeling infection, spike protein behavior, and drug screening. HEC 293, fetal kidney, 1973. Testing used Pfizer Moderna to verify mRNA protein express. PRC6, fetal retina, 1985. Produced used by J&J to actually grow the viral vector used in their shots. Okay, so there's different ones. So this would be, they used HeLa cells, Henrietta lacks cells, for the basic research, modeling, infection, spike protein behavior, and drug screening. Okay, and then okay, I see there. Now, let me see something. Let me ask one question here. How many people were how many people had their cells taken and tested for medical use before they discovered lax cells worked? I'm just curious about that. I'm presuming it was by accident. Look at this. It was by accident. That's what I mean. I don't think anybody has her bloodline. You see what I mean? It's impossible to give an exact number because medical records from the 20th century were not centralized, but historians and scientists estimate that thousands of people had their cells taken and tested before George Guy successfully grew the HeLa line. So there was a lot of people's blood that was tested. And their cells were taken, right? Now, for decades, the quest to grow human cells in a lab was considered the holy grail of biology for decades. And the process was largely a massive, uncoordinated trial and error effort. Dr. Guy's assembly line. Dr. Guy, the scientist who finally succeeded with Henrietta's cells, had been trying to grow an immortal human cell line for nearly 30 years before 1951. So he was an old man when he stumbled across this, right? Pretty much. He took samples for every cervical cancer patient who walked into Johns Hopkins Hospital regardless of their race and status. So they took a wide variety of samples too. Hundreds, perhaps thousands of these samples were processed in the lab alone. In every single case, the cells died within a few days. Henrietta's were the first out of thousands to survive. And you don't know how many that could be. Could that be 5,000? Could it be 10,000? I mean, but the man has been on this quest for 30 years before he discovered it. So the error, tacit consent. In 1940s and 50s, it was a standard global medical practice to take surplus tissue during biopsies for surgeries for research. No record because this was routine. Doctors rarely kept a master list of whose cells were being used for research. They were simply viewed as biological waste. Okay, so the scale, so your body, they didn't have to ask you back then. Nobody. They didn't have to ask, apparently. The scale multiplied by thousands of hospitals and research labs across the U.S. and Europe. It is estimated that tens of thousands of individuals had their tissues sampled for the same purpose without their knowledge. Animal versus human success. While human cells were failing, scientists had already successfully grown animal cells. In 1912, heart before lax, the most famous immortal cell were from a chicken heart, cultured by Alex Carrel. He claimed they lived for 34 years, though it was later discovered he was cheating by adding new cells to the mix. Yeah, there's always going to be that too. Obviously, apparently. This success with animals led to a frantic 40-year period where scientists poked and prodded thousands of human subjects trying to replicate the results in people. Damn. Why Henrietta's cells worked when others didn't. Yeah, why? Scientists now know that it wasn't just luck. Henrietta's cells had a unique, perfect storm of biological traits. The HPV-18 virus. Her Pacific strain of cancer was caused by HPV-18, which inserted its DNA into her cells and turned off the p53 gene, the cell's kill switch. So damn, so it's like a mutation, right? Okay. Telomerase. I don't know how that's pronounced. Her cells produce an overabundance of an enzyme called telomerase, right, which repairs the ends of the DNA. This meant her cell didn't age or wear out after dividing, making them truly immortal. Okay. Wow. Okay. So in the 1910 to this is the turn of the century to the 1930s, it was only mainly animal embryos, chickens, and frogs. Temporary growth, no immortal lines. 1940s to 1951s, thousands of cancer patients at a major hospital that was Hopkins in Baltimore. University failure, human cells always died. February 51. Okay, that's damn, that's 55, 65, 75, 76 years from 75 years ago, right? That's 75 years ago. Henrietta Lacks HeLa success. The cells doubled every 24 hours and never died. Okay. So, yeah. So in any case, y'all, let me try to pull up some articles from here real quick and just review some of them. Wow. This was great. This was a, great happening that just occurred. I'm so happy to know this. Let me just look this up real quick and see if I can find another article here. Oh yeah, I don't want to shut that down. Let's do this. Let me see. Henrietta Lacks. And I'm sure there's plenty of articles about this today or in the last couple of days. Look, here we go. Here we go, y'all. Let's pull up some of these articles. I mean, she died on October 4th, 1951. Wow. She died back then, the same year that they took her cells. Can you believe it? Let's see. Novartis settles. Here we go. Let me take this off here. Later. Boom. Here we go. Novartis settles with Henrietta Lacks estate over the use of her stolen cells to advance medicine. Right. And I wonder what country Novartis is at. Oh, it's a Swiss company. Okay, there you go. Swiss pharmaceutical company. Let me see here. Okay. The file shows. Oh, let me shut this down. Here we go. So let's see. Can I get into this article or what? Okay. Novartis has settled the lawsuit by the estate of Henrietta Lacks. Now, what's curious here now. Peep this. This is somehow like this is a Swiss company, but it's in a family out of the U.S. that's suing her. Right. So let's peep game. Novartis has settled a lawsuit by the estate of Henrietta Lacks that alleged the pharmaceutical giant unjustly profited off of her cells, which were taken from her tumor without her knowledge in 1951 and reproduced in labs to enable major medical advances, including the polio vaccine. Details of the agreement, which was finalized in a federal court in Maryland this month, aren't public. So we don't know how many millions, right? We don't know how many millions, but it's definitely not just about money. It's about their mom, you know what I mean? Their grandmother and those days and what happened to her. And yeah, it's also about women's rights too. You know what I mean? It's like, women have to struggle to own their bodies. You know what I mean? And there's people out there telling women what they can do with their bodies, you know, and a lot of people have that idea. And here we have people taken from their bodies and using it for medical research. Right. So, I mean, but in any case, that's just how it, you know, strikes me, you know. Now, of course, it's not framed that way. You know, I guess they have to go another route. But yeah, to me, it's a story of whose body, who owns this body. And I think that should ring volumes to anybody that's out for freedom. I mean, I say this all the time to people. The reason why I don't bother with what other people do with their bodies, because I believe in anti-slavery. I believe nobody else owns that body. I don't have the right to tell other people what to do with their body. So I just don't. You see what I'm saying? And I hope other people respect me. Like, hands off my body, yo. Like, straight up, hands off. It's not yours. You don't get to tell it what to do. You don't get to take from it. You don't get to have nothing to do with it. It's not yours. Now, the Lax family and Swiss-based Novartis said a joint statement that they are pleased they were able to find a way to resolve this matter filed by Henrietta Lax estate outside of court, but aren't comment. Yeah, there you go. They were pleased they were able to find a way to resolve this matter outside of court. That's great. Okay, it's the second settlement in lawsuits filed by the estate that accused biomedical businesses of reaping rewards from a racist medical system that took advantage of black patients like Lax. The settlement ends litigation between Novartis, one of the world's largest pharmaceutical companies, and the estate of Lax's mother, who died of cervical cancer at the age of 31 and was buried in an unmarked grave. Okay. The 2024 lawsuit had sought from Novartis the full amount of its net profits obtaining by commercializing the HeLa. Damn. The lawsuit had sought from Novartis the full amount of its net profits obtained by commercializing the HeLa cell line, which the complaint said had been cultivated from stolen cells. Doctors at Johns Hopkins Hospital took Lax cervical. This reminds me of something else, though, I'm going to mention in a minute. Lax cervical cells in 1951, without her knowledge, and the tissues taken from her tumor before she died became the first human cells to continuously grow and reproduce in lab dishes. HeLa cells became the cornerstone of the modern medicine, enabling countless scientific and medical innovations, including the development of genetic mapping and even COVID-19 vaccines. But the Lax family wasn't compensated along the way, despite that incalculable impact on science and medicine. Johns Hopkins said it never sold or profited from the cell lines, but many companies have patented ways of using them. Okay. In 2023, Lax estate reached an undisclosed settlement. Well, okay, so this is another one now. With another company, biotechnology company, Thermo Fisher Scientific Incorporated. Lawyers for the family argued in that case that the company continued to commercialize the results long after the origins of the HeLa cell line became well known and unjustly enriched itself of Lax cells. Okay, there are other pending lawsuits by Lax estate. Just over a week after the estate settled the case with Thermo Fisher Scientific, attorneys for the estate filed a lawsuit against Ultragenyx Pharmaceutical in Baltimore federal court, the same venue as the previously settled case. Litigation and the Ultragenyx, as well as Viatris, a pharmaceutical company, remain active. Attorneys for her family have indicated there could be additional complaints filed. Lax was a poor tobacco farmer. This is more about her now. She was a poor tobacco farmer from Southern Virginia. Damn. So she was in Baltimore, but she's from Southern Virginia. DC's right between both of them. Her husband, let me see, farmer from South Virginia who married and moved with her husband to Turner Station, a historic black community outside of Baltimore. They were raised 5 children when doctors discovered a tumor in Lax's cervix and saved a sample of her cancer cells collected during a biopsy. While most cell samples died shortly after being removed from the body, her cells survived and thrived in laboratories. They became known as the first immortalized human cell line because scientists could cultivate them indefinitely, meaning researchers anywhere could reproduce studies using identical cells. Yeah. And here go the cells, I guess. Is that the cells? All right, 2 seconds. Hold on. I can see this is freezing up. So, yeah, here we go. Yeah. Remarkable science involved. The impact on the Lax family, some of whom had chronic illness and no health insurance, were documented as in a best-selling book by Rebecca Skloot, The Immortal Life of Henrietta Lacks, which was published in 2010. Oprah Winfrey portrayed her daughter in an HBO movie. Okay, I didn't know that about her story. There we go. I wonder if this will impact. Well, somebody wrote this. I wonder if this will impact organ donation practices. Will donors' family require payment for donations? Isn't that illegal? There's always some. You know what? This is so funny. Again, this is anti-own your body stuff right here. This is you don't own your body argumentation. Where is it going to go? Someone's using it. Someone is profiting and benefiting. It's not like you have to profit. You don't have to profit. Not like that. Nobody has to, no, there doesn't have to be a CEO that gets $1 billion. Did you know that? A CEO doesn't have to be paid $1 million a year. No, you could just donate all your time, right? There doesn't have to be an economic reward. And here this person says, I wonder if this will impact organ donating practices. No, not if you act fair about people's bodies. It won't. And on top of that, they have to ask you, what the hell is this? This don't even make no damn sense. They have to ask you today. They have to ask you for your organs when you donate them, man. This is some bullshit. Tay Bunhun. Yo, you see this thorn? You see this shit? It's confusing me, man. Just reading this shit is confusing me, yo. Look at this argument right here. I wonder if this will impact organ donation practices. Will donors' family require payment for donations? Isn't that illegal? Will it stifle organ donations? There are downsides to this greed that could have serious impact. They're calling her family greedy. They calling her family greedy. And all they're saying is that ask. Why not ask? Isn't that what they do today to organ donors? They ask you to donate. Yeah. Did you know they asked you to donate today? These people, you see this? I knew it was going to pop up somewhere. I mean, it's called gaslighting. When it comes to owning your body, which harkens back to slavery, any conversation about an individual owning their own body harkens back to slavery. And that's why I'm always mindful of the way this shit splits up. This is Henrietta Lacks. Her family just won another case, biomedical case for using her cells, right? And you know what I'm saying? Purple, what's up? This is some crazy shit. I mean, this says it all right here. This says it all. Scott, is that Elon Musk bot and shit? You know what I'm saying? It's a mad person's bot. Some evil scientist is out there like, I want to own your body. So how can I get on the internet and convince you that you don't need to own your body? Look, this is a complete utter lie. I wonder if this will impact organ donation prices. Will donors' families require payment for donations? Isn't that illegal? Will it stifle organ donations? There are downsides to this greed that could have serious impacts on many people's lives. When you donate an organ, you're being asked to donate it, jackass. Henrietta Lacks wasn't asked. Okay, that's the point. All you have to do is fucking ask. You know what I'm saying? Ask. Why don't you ask? What's wrong with asking? You know what I'm saying? What's wrong with giving someone ownership over their body, or not giving it to them, upholding the ownership an individual has over their own body? I mean, it's crazy. It's crazy, man. It's crazy. I don't understand it, but it's bound to. Let's read one more. I don't want to make it. Look, why is stolen in Scar quotes? Look, is it disputed? Is this disputed? Yeah, that's true. Stolen. Is it disputed? No, it's not disputed. Not that I disagree with you, but using the definition means there's almost an infinite amount of theft going on in this world. Maybe not. But I want to ask one other question. Let me ask. Hold on. Let me see. Travis wrote, it's a shame that her cells were taken without her permission. That said, some amazing medical advances resulted from her cell line. It's good to see her family is finally and justifiably benefiting financially from this extraordinary situation. Yeah, I think so, man. It's not like they're hurting people. Plenty of people making money. Plenty of people are getting helped. And yeah, the question is, are you supposed to ask or not? Or can you just take somebody's body parts and use them and just be damned with their family or be damned with what they think? Is that the world you want to live in? Now, let me see something. I want to, what intersections does this story have with Jim Crow, period, and rights? I'm just curious about that because I saw a mention of it in that article when they were talking about African Americans, but I want to know, did it apply to more people? Okay. The story of Henrietta Lacks is not just a medical history. It's a quintessential Jim Crow story. Okay. The discovery of HeLa cells happened in 1951 at the height of the legal segregation in the United States, and the racial dynamics of that era shaped every single aspect of what happened to her. Here are key intersections between Henrietta's life and the Jim Crow era. The colored ward at Johns Hopkins University. Okay, so when she went there, she had to go to a colored ward, a segregated ward at the hospital, right? Although her cells are going to be used to help everybody. You know what I'm saying? And they were around the world, in numerous ways. Didn't just go to help medical patients. People got rich. Industry got built on this stuff, Okay, now let's see here. Access to care. Henrietta had to travel 20 miles to reach Hopkins because it was the only major hospital in the region that would treat black patients. Okay. Physical segregation. She was confined to the colored ward. History shows that facilities for black patients were often underfunded, overcrowded, and staffed by fewer doctors than the white wards. Okay. The public patient paradox. At the time, there was an unwritten benevolent rule among doctors. Because the hospital provided free care to the poor, mostly black patients, the doctors felt they had the right to use those patients as research subjects without asking. So it's a bigger dynamic going on. It's not just her cells. It's not just about her cells. It's about other things that were going on in the hospital that go along with that whole time period, and I don't have to ask, I can just use you. Right? This kind of thing. Okay. 2, lack of informed consent. Under Jim Crow, black Americans were often viewed as clinical material rather than autonomous citizens with rights. The silent theft with Dr. Lawrence Wharton Jr. took the tissue from Henrietta's cervix. He didn't ask her permission. He didn't even tell her he was doing it. The power imbalance. Okay, so I'm curious, could they do this to others, to non-blacks also? That's what I want to know. But I don't know. And that's the wonderful thing about me, because when I don't know stuff, I don't pretend to know. I just research it and ask. Right? Because you will find out a lot that way, a lot more than you would by guessing. Right? Now, the power imbalance. 1951, a black woman in the South was socially conditioned not to question a white doctor in a position of authority. This power dynamic made informed consent virtually impossible. Okay, 3, scientific racism and the blood fear. During the 1950s, many white Americans were terrified of blood contamination, the idea that black blood was inherently different or dirty. The irony of HeLa. While the law kept black and white people separate in schools, buses, and water fountains, scientists were using Henrietta's black cells to develop vaccines, treatments that would be injected into white bodies. The HeLa bomb. In the 1960s, the scientist named Stanley Gartler revealed that HeLa cells were so aggressive they were contaminating and taking over other cell lines in labs worldwide. This is crazy, man. This sounds so funny. They're so fucking aggressive, these goddamn cells. This caused a panic in the scientific community that mirrored the racial anxieties of the era. The invisible black cells were taking over the white research. This is why I never assume shit, man. You never know where stuff is going to turn, to be honest. I didn't expect that one. Okay. Economic disparity and the wealth gap. The most painful intersections is the economic one, the profits. While companies like Thermo Fisher and Novartis built billion-dollar empires using her cells, Henrietta's family lived in poverty for decades. The healthcare irony. For years, Henrietta's children and grandchildren could not afford health insurance or the very medicines that were developed using their mother's cells. I hope Americans don't think this is normal and okay, because it's starting to sound like why people don't have health care today, too. You pay into some shit that you can't even get. Okay. This is a direct reflection of the general wealth gap created by Jim Crow era policies. Okay, 5. Tuskegee connection. Henrietta's story is often linked to the Tuskegee syphilis study, which was ongoing during her treatment. Both represent a period where the medical establishment used black bodies for the greater good of science while ignoring the humanity of the individuals involved. Yeah, so yeah, there's intersections there. Okay, Jim Crow reality, the impact of Henrietta Lacks. Segregated hospitals forced her into a colored ward at Hopkins. Medical paternalism. Doctors took her cells without asking, viewed her as material. Economic exclusion. Her family, yeah, and there's some gender bias there too. Medical paternalism, right? Okay, economic inclusion. Her family was barred from the profits her cells generated. You know, I would think women might want to get behind this too. You know, regardless of your color. Just women in general may want to understand where this is not good, right? Economic, you know, the thing about owning your own body and being asked and being told, right, at a doctor what's going on, being properly informed. Economic exclusion. Her family was barred from the profits her cells generated. Legal erasure. Her name was hidden, referenced to as Helena Lane for decades. So they just actually changed her name. Yeah, they changed her name. So people didn't get a chance to know who she really was or know the real story of Henrietta Lacks, although they benefited, you know, everyone alive today, some way, shape, or form has benefited from Henrietta Lacks' cells, regardless of who you are. Yeah, Henrietta Lacks died in October 51. Let me see. And she was born in Roanoke, Virginia. She was born in Roanoke? Damn, I didn't know that. She was born in Roanoke, Virginia. Yeah, that's an interesting story, y'all. And there's plenty of links you could see. Henrietta Lacks. There's plenty of stories about her. Let me see here. This is another picture of her. I didn't see this one. This is a different picture of Henrietta Lacks. Okay, well, here you go. I'm glad to see this picture. This is the woman right here. Henrietta Lacks. Damn, she was a fine dresser too. Cause see, I like that jacket she has on. Yeah, her cells were used, and to the benefit of many. So yeah, so it's good to see her family resolve some of the case of their grandmothers, of the injustice to their grandmother, and also the civil rights aspect of it, the human rights aspect of it, you know, is being acknowledged finally. And I think the companies that have acknowledged that and then made settlements, and I think that's a wonderful thing, man. I think that goes a long way. Yeah, it just does. Again, you know, if you don't learn from your mistakes, you're doomed to repeat them. And there's no point. If you benefited and you benefit, there's no point in correcting the errors too. You see what I mean? Along the way. So, yeah, that's interesting, y'all. Henrietta Lacks' family, they won a new court case today. So I'm just like, wow. Yeah. She died 75 years ago. Yeah, she died 75 years ago. I learned about Henrietta Lacks about 5 years ago. Her family didn't know for decades. Yeah, they didn't know. I learned about her I learned about Henrietta Lacks. I'm going to be honest with you. I learned about Henrietta Lacks in 2007. Yeah, 2007. So it's almost 20 years now that I've known about her, but she wasn't winning cases back then. These new cases are all in the 20s that she's won, that her family has won. So it took 20 years. First of all, it took years to enlighten people of what happened, right? Of the truth about what happened. And now that like I first heard about her and some videos in matter of fact, on YouTube, some videos on Henrietta Logs. Yeah. 20 years ago when YouTube first jumped off, 2007. Yeah. That's a long time ago. Right. And, I think it was 2007. Was it Facebook or was it YouTube? It was back then, because I remember Obama was running for president or something like that soon, 2008, 9, something like that. It was some time back then. I can't remember, but it was some time ago. Let me see here. With every crime exposed, there are many more kept hidden. Yeah. I mean, I think when you're dealing with civil rights in this period of time, there's a lot to be discovered. But my advice to people is, they have this saying, keep your heart as light as a feather. That's my advice to all engaged. Keep your heart light as a feather. Having a healthy approach to examining wrongs and civil rights and things like that goes a long way in the outcomes. You know what I mean? There's a lot of people either way. There's some people that will look at this as like they would just want to shut down and not learn anything about it, because in their mind, they're not able to deal with the consequences of it. But listen, my advice is that the information is not meant to harm you. The information is meant to make everybody better, make everybody whole. And if you're running away from being whole, something's not right about you. So although, going into the past, and this is not really the past because we still live in it. I mean, her body is being used. It's being used for everything. Everybody. So what's the point in running from it? Why not just embrace it? Right? And the only way you can really embrace it is to acknowledge it. Right? That's how you embrace it. You can't embrace it if you can't acknowledge it. You see what I mean? And if you can't acknowledge it and you can't embrace it, you kind of can't move on as a whole in a complete way. You see what I mean? So I don't see the point in, nobody's perfect, and I don't see the point in people running from stuff like this. I think the thing that makes it extraordinary is when people, or well, I don't know if it's extraordinary. What makes it problematic is when people run from it. What makes it extraordinary is when people are able to just face it as human beings, man. Nobody chooses what color you are when you're born. Nobody chooses where they're born. Nobody chooses who they're born to. It just is. It just happens. So in that, I think there's a way for everybody to kind of confront these stories. I don't think it's just a story about Jim Crow or just a story about black bodies, but I think it's a story about ownership of your body, anti-slavery, pro-human rights. I own my body, and everybody should want to own their body. Everybody should want to own their body, no matter who you are. You should want to own your own body. You should want to make the decisions about your body. That's what this is about. And I think everybody should be able to come into that conversation and understand that that's a good thing. You owning your body is a good thing, because it could easily go the other way. It could easily go left. And it does go left for a lot of people, man. A lot of people give up their rights. A lot of people give up their rights without even knowing they're giving them up. That's crazy. That's so crazy. And arguments like this will do it for you. Look at this argument. Who made this argument? This is the craziest argument I've read yet. I'm amazed by that damn argument. It just make me wonder. Is it this one right here? Is it this? Somebody said something in here that was so bizarre. Hold on. Is it this one? Let me see. Is it this one? No. Okay. Well, I don't know where the article is anymore, but it was the one I was citing earlier. Someone just said something about, this is going to be a problem for organ donors, to own your own body. Do we have to ask everybody? Someone had the nerve to write something like that. This is excessive greed. This is going to be a problem from organ donors. It's like, man, you even have to ask organ donors, idiot. But so, again, People can be tricked out of their possession of their own bodies, man. And that's a horrible thing to do. And I think anybody that really understands it, I don't think you shouldn't have to understand slavery to understand this. But if you might need to, if that's what it takes, then that's what it takes. But you want to control your own body. That's the premise, the basic tenet of human rights. I own my body. I don't own your body. I own my body. Nobody owns your body. You own your body. And to give up ownership of that is slavery. You know, they isolated it away from the cows, and 100 cows are just getting a tiny bit of courtesan. You know, I mean, I think there's a lot of beautiful stories like this. Okay. Let me see. Yeah. Get it. Hold on. Let me see. Isolated away from cows, and it took 100 cows to just get any tiny bit of courtesan. Is that what you're saying? Yeah. In any case, man, I'm gonna be back, y'all. I just wanted to touch on that story. When I saw that their family won another case, I thought, like, wow, this is a story. Look, it connects a lot of people. This story, Henrietta Lacks, in the turn of the century, born 1920s, right? She was born in Norfolk, Virginia, right? She died in Baltimore, Maryland, right? That's just between those two places, or between where I'm born, Washington, D.C., right? I mean, I'm born between those two places. But yet her cells have been gone across the world. Her cells have impacted the world that I live in. I got a vaccine from Pfizer, and they use Henrietta Lacks' cells. And I'm all the way over here in Denmark. You see what I'm saying? So we can use these stories to connect us all, because we all are connected, you know, or we can use it in a way that divides us, you know, and people have to decide that for themselves. Me, I try to use it in a way that unites us, you know, because I've lived along. I'm 55 years old. I've heard a lot. I've seen a lot. You know, I've had a chance to examine human beings, and so I choose to unify people and not to divide people. You know, I'm not with all this division and things like that. Pride doesn't mean division. You know, pride's not special. Everybody has pride. Everyone should be allowed to have pride. It doesn't make us different. Religion doesn't make us different. Everybody has religion. We talked about that earlier today. When Friars was up here, people make a religion up to comfort themselves. That's what they do. That's what all of humanity has done. Right. And, you know, we don't have to argue over it, because it's basically all the same thing. You see what I mean? Like, you know, but some people will find ways to fight and argue over religion. That's what some people do, you know, instead of finding ways to translate it, you know, to, yeah. And then, you know, there's a lot of other examples that go along with that, you know, about how we get divided on politics. I mean, we got Republicans and Democrats, and yet we don't have health care for everybody and education for everybody in the richest country on earth. How do you think that happened? Division. People choosing to divide instead of work on what unifies us. You see what I mean? And so I'm more for the unifying thing, because we are actually all one, regardless of the past. We were one in the past, but we can learn from the past. You see what I mean? We don't have to repeat it, you see. But what's up, Eric? Yo, I'm about to be out. I'll be back. I'll be back soon. As a matter of fact, hold on now. I did want to see, there was a couple things that came up. I don't want to, you know what I'm going to do? I'm going to stop the stream, and then I'm going to start a new one. I want to let this one be where it is, but the next one, I'm going to time in on the news real quick before I'm out. So I'm going to catch up with you guys in a second. In like 2 minutes, I'll be right back in the next live. So appreciate everybody for checking this one out. Those of you that hear this later, hey man, I hope you enjoy it. Henrietta Lacks is part of your life. Henrietta Lacks is part of everybody's life. A piece of her might be inside of you. You know what I'm saying? You know what I mean? You know what I'm saying? Literally. So All right, now I'm out. I'm gonna catch up with y'all in 2 minutes. See ya. Let's go. I'll see you on the other side. 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 They want war.
Crime babies looking for food, starvation, the recipe, people subdued. When the people you trust got it in for you. Deceit is the word of the day in every crew. Don't let it go. It's from the days of old. Time is up, but some still do not know. Can I make up my mind? Is it worth the dime? Do I have to take a minute just to make it mine? Life's never fair, but don't listen to the TV. Go out and take a listen to the streets with the people in the slums and the homeless bums with degrees and degrees sitting under a tree. It's not easy in the world for the poor man, the one that brought you to reality. See, they don't want you to know about the black sheep. Even 7 rows to the 12 families all around the globe with an ancient code. Is it really asking a lot to say a death old? Cause we sitting on the earth looking back at extinct, and I'm standing on some ground that's about to sink. I ain't scared for a minute, I ain't about to blink, but I documented for the world what I see and think. Feel we on the call and up and we on the brink. All Congress gonna do is waste paper and ink. Vote or die, you voted and you'll die. You can have it both ways, can't say it's a lie. You can march all you want, but they playing you wrong. They only understand war, it's the same old song. They want war, all they really want is a war. Diversionary tactic to make the big score. The diamonds in the mud, then you know they want more, but they wanna keep it low, so they manifest the war. All they really want is a war. Diversionary tactic to make the big score. The diamonds in the mud, then you know they want more, but they wanna keep it low, so they manifest the war. Like the lotus coming out of the mud with colors, I create envy in those with power but jealous. I unify the poor with my song, the hell with the others. Descended the way they treat indigenous brothers, cause I understand we link forever. They try to hate us even though that we keep it together. I'm not talking about controlling the air or the weather. I'm talking about maintaining the truth, the high endeavor. A rebel drops bombs in the midst of trouble. The free world counterattack and now there's double. But nature gets the shit in a way to settle. If you stop the machines for a minute, you might hear, but they won't, cause the TV's whisper in the ear. And capitalism has eyes that don't dare, and they cloud up and get crazy and won't stare. And like an ad, it's hard to get an ass to listen. Living like this is like living in prison. It's hard to keep hope when you're living in prison. The spiritual thoughts, so yes, the mental prison. The outside, yes, it's got to get through. Something's gotta die, so something here can live. Your life is nothing if you got nothing to give. Keeping the spiritual, yes, disguise is religion. Controlling your mind, the mental prison.